whoever popped in first is whoever it started recording to. And that whoever that person is will get an email post saying your Zoom recording is ready. So just a heads up, whoever whoever gets that present after the presentation. Yeah.
Keep an eye out for it so we can save it. I know folks always who register for the conference want to request and watch it later, or perhaps different presenters want it. We will see. Okay, well, we're right at 12 p.m. Eastern Standard Time. I think I'm the Zoom room monitor. That's the last thing I saw. So I'm going to go ahead and welcome you all to our next presentation, Psychedelic Therapy and Counseling, Progress, not how do you say it?
Panacea.
Thank you. I'll be, like I mentioned before, I'll be your Zoom room monitor. I'll let the presenters introduce themselves here in just a few minutes. But before the presentation starts, I just wanted to remind attendees of a few important points. This session is 50 minutes. We'll also be offering CEs for those of you who registered for a CE option. I know a couple questions have came across to us. If you're not sure if you registered for a CE, you can always email myself or Dr. Pytel to clarify if you did. If you changed your mind and you wanted a CE and it turns out you weren't registered, we can always work with you on that as well. We are registered by NBCC to take attendance and verify that those that are requesting CEs attended. So what this means is you'll have to keep your video on for the vast majority of the presentation, so that way we can verify your attendance. It also helps, knowing that I'm on this side of things, if you can also make sure that the name, if you want CEs, the name that is on Zoom, if you can make sure that that also coincides with the name you registered under. Otherwise, it gets a little challenging to figure out who is who. We will have captions on, and like we mentioned before, we'll be recording this session. So please keep this in mind when it comes to making comments. I'm here to help you if you have any questions or issues during the presentation. However, if it's a question related to the presentation, please make sure to express that to the presenters. Thank you all for being here.
Thank you, Dr. Paycheck. I'm going to start to share my screen. All right, can everyone see what I am looking at here?
Yes.
Okay. Trying to find a way to minimize. What I'm looking at. No, that's not what I want. How about now? Do we see the slide or we see just the center view? All right. All right. If you are seeing the first slide, is everybody good to go here then? Great. Okay, wonderful. Thank you all so much for joining us today in your lunch hour. Please feel free to bring your lunch and snacks and coffee and whatnot. And we really appreciate you being here. For our Dr. Blaine Riley and myself, Joshua Moyer, our presentation on, this is an introductory session on psychedelic therapy in counseling titled Progress, Not a Panacea. So it's not a cure-all, it's not a fix-all, but it is a quickly developing and wonderful mental health endeavor. So we're going to talk about that. But first and foremost, if I could have Dr. Blaine Riley tell us a quick bit about yourself, if you don't mind, sir.
Yeah, Dr. Blaine Riley, he, his, him. I currently teach at Boise State. I also am part of a small group practice. Let's see, my interest in psychedelics stems way back, you know, in the 90s, you know, and it sort of kind of has merged with my other developing interest that started with my undergraduate of transpersonal psychology. Since then, I've been, studying, trained in Gestalt, studying practice mindfulness, and currently excited about my somatic experiencing training that begins next week. And so it's just an interesting thing for me to talk about psychedelics because I'm also as a client, I'll be speaking from a client perspective about my journey with ketamine-assisted psychotherapy. So yeah, how's that, Josh? Is that good?
That is absolutely perfect. Thank you so much. And my name is Joshua Moyer. I'm a CMHC student here at Lock Haven University on the veterans track, but also quite active in the psychedelic-assisted therapy space. I work with several, consulting with several psychedelic therapy outlets on social media and advocacy and promotion, and have spent many, many hours in the past few weeks listening to the FDA and kind of helping our those in the psychedelic setting deal with that has been going on. So very excited for this talk and to collaborate with Dr. Riley. And thank you all for letting us speak here. Now, first, I would like to invite everyone on the call to just drop one word in this is the experiential part of the session, drop one word in the chat, letting us know what you think of when psychedelics are mentioned. Dr. Paycheck, I will ask you just to kind of shout a couple out, or we can kind of compile them and wait till the end because my screen is only showing.
It's hard. It's hard when you run that. Yep. Relief, micro dosing, symptom management, weed, ketamine, mushrooms, conscientiousness, neurological pathways, hallucinations.
These are wonderful. Thank you so much. So we will cover all of those in our 6-hour session. No, I'm just kidding. I'm just kidding. We only have 50 minutes.
Experientially?
Yes, exactly. But we could go through all of that. So thank you for all that. And I please feel free as things come up to add them to the chat. And Dr. P, just feel free to go ahead and stop me. If any of you have been in class with me before, that's pretty much what you got to do to get me to stop talking. So first and foremost, we urge you to, when it comes to psychedelic-assisted therapy, when it comes up in conversation, when it comes up in class, when it comes across your newsfeed and social media, first, as mental health professionals, we need to get past the stigma, okay? Do not rely on whatever news outlet is coming out, whatever celebrity is speaking on psychedelics. We urge you to, if you have questions on psychedelic therapy, ask those questions to those in the mental health space. Rely on the research that we have access to, and really kind of be careful with what you're seeing come out, because there's a lot of news and a lot of noise. So, but there's also a lot of very, very rich research coming out, and a lot of people being helped, and a lot of communities that have benefited from this kind of therapy. So we urge you to do that first and foremost. And Dr. Riley is going to jump in here with the importance of set and setting.
Yeah. So I'm not seeing the slide. I don't know what's going on.
No?
No.
Anybody?
I'm seeing wonderful faces and whatnot, so that's fine. So set and setting, originally I think it came from Timothy Leary. And one thing about Timothy Leary is that he went away from the sort of rigorous methods of research, and and then government got involved and all that. But prior to Timothy Leary, there was actually a lot of good research being done. I think LA area, Minnesota area, maybe Canada, in the 50s and 60s, rigorous research being done, LSD and its effects on alcohol, or those that are identified as alcoholics. So I just wanted to point that out too, that there was just a lot of that great research happening, and then this sort of cultural shift. And one thing, if you're really curious about it, I would read this book. It's not a textbook, Michael Pollan's How to Change Your Mind. And he comes from a healthy skepticism. So anyways, set and setting. Set is really the intention you bring. And I think later on, I'll talk a little bit about the importance of developing with your counselor or psychiatrist, developing a sort of intention, not expectation. But I think it's also the relationship that you develop with either the people administering or the people that are journeying with you as you dose. And then setting is just the environmental context. It's not going to be a cold clinical setting. It's going to be, there's going to be curated music. There's going to be a nice lazy boy couch. There's going to be an eye mask, weighted blankets. It's going to be, you can bring in what you want to bring in comfortable, bring in tactile, things that help ground you. So I think that's also the important thing, because then you're able to really set up a successful journey for yourself. And so I think that's a lot of intention goes into preparing. And I think that also can help reduce the stigma of that, it all of a sudden somehow incites or elicits this sort of chaotic experience, out of control, and all that. So yeah, I don't know. Again, I can't see the slides, but I don't know if there's anything else. Let me see if I can't find the slides. Yeah, so thanks.
Thank you, Dr. Riley. Sorry about that. Is anyone else having trouble viewing the slides?
Yes. They were here for a second and then they disappeared.
Okay, let me see here. Sorry about that. How about?
I mean, they're like beautiful slides.
How about now? No?
Not quite yet.
All right, 1 second. Let's try this one more time. Apologies all. Give me one moment. I'm going to reshare my screen. Okay.
Your desktop is showing now.
Yeah. I'm going to swap.
There.
How about that?
There you go. Yeah.
We can see?
Yep.
Wonderful. Thank you. Great. All right. I apologize for that delay there, but thank you, Dr. Riley, talking about the set and setting, which, as Dr. Riley mentioned, really goes back to the very beginning of the psychedelic movement in the 60s. And Dr. Riley also did mention a very interesting fact regarding psychedelic research and alcoholism. And fun fact, Alcoholics Anonymous was founded because the founder had a very transformative LSD experience. So you can put that in your hat of facts at cocktail parties. So
yeah. Going back to just the brain is in that vulnerable state where it's kind of that plastic state where you can make those connections more, and it gets away from psychedelics. Help ease up the default mode network, the network that's basically responsible for the sense of self, and it helps us understand us and environment. And so it becomes that sort of quiets that mode down. And that mode, overactive default mode network, is also kind of responsible for that ruminative thinking that's sometimes just associated with depression and anxiety. So clients are in that real vulnerable state is kind of what I want to say. And so how you are as a therapist is very important. And we'll talk a little bit more about that. Anyway, sorry. pass it back on to you, Josh.
No, thank you very much, Dr. Riley. So let's talk about what psychedelic compounds currently are showing efficacy through research. Again, always go with the research. So number one, I think one that we're all the most familiar with would be ketamine. Now, ketamine is technically a dissociative, so it's not in the vein of traditional psychedelics. But at lower doses, it can disrupt negative feelings and preoccupations and help the brain create new, healthier patterns. It does this by promoting neuroplasticity and normalizing activity in the part of the brain known as the default mode network, which is what Dr. Riley was just talking about. Next, we have psilocybin, which is a psychoactive ingredient found in certain species of mushrooms, has been shown by research to help with depression, anxiety, PTSD, and substance use disorders. And it does this by bonding with serotonin receptors and dopamine receptors to a lesser extent. And what's fascinating about this, and I just found this out, psilocybin has effects on the amygdala and hypothalamus that aids in circadian rhythm regulation, which is really neat. That's you can put that on your list of a 3 a.m. Google deep dive. So, and finally, MDMA therapy creates feelings of empathy, openness, and reduced fear. And this has been shown to be helpful in treatment-resistant depression, anxiety, PTSD. There's particularly in veterans. Again, that's kind of a buzzword this summer that we've had. And social anxiety in autism spectrum disorder as well. And then some other psychedelics which are fascinating, and I invite you to do the research on. First is ibogaine, they're found to be wildly effective in addiction spaces and substance use disorders, in so much as it's been shown to quell those effects in one session. But a lot of research still needs to be done on it because it's such an intense experience. There has been some issues with cardiac issues in the experience. And I believe, Dr. Riley, correct me if I'm wrong, the clinics in Canada and Mexico that are doing it, you do have to be hooked up to an EKG the entire time of the session, I believe. Is that correct?
I honestly, I can't remember.
Okay, I think I believe that came up in conversation, but it would make sense to me.
Yeah.
And also, too, ayahuasca, I'm sure some of you have heard of it. It is actually a combination of two medicines that, again, widely has been shown to be very effective. But again, research still needs to be done. But most importantly, what diagnoses are we talking about here? What can be helped? So PTSD, this is first and foremost. Again, substance use disorders, end of life anxiety with cancer or otherwise, or generalized anxiety disorder, grief and depression, specifically treatment resistant depression, and it has been eating disorders as well. There has been a study on bulimia. Oh, excuse me, no, binge eating disorder is a study that's active right now, but it has been shown to work in that vein. And of course, because we are counselors and this is a CMHC conference, what theories and modalities can this be used for? Here are just a few to get to wet your whistle and get you started. So first, cognitive behavioral therapy. It can aid in that setting to identify and change unhelpful thoughts that your client is having. Motivational enhancement therapy helps to remove the barriers that are keeping them from making healthier decisions. Person-centered therapy, and it helps to help the client discover themselves, discover their own solutions, to understand themselves and why they make the behaviors they do, and thereby to change them. And finally, existential therapy. It helps the client to find meaning and purpose in their lives, confronting death anxiety and finding their place in existence. Again, another big word that I'm sure you've heard if you've done any dabbling in this space is ego death, which is a profound and intense and transformative experience that happens as part of a psychedelic medicine session where the person's sense of self and personal identity dissolves temporarily, of course. But then, the real work is afterwards when in the integration stage, which Dr. Riley will touch on a little bit later. So if you would, Dr. Riley, we'd love to hear your personal perspective, particularly with ketamine-assisted therapy.
Just in terms of time frame, maybe 10 minutes, because, it could be a little bit longer. So I'll shoot for 10 minutes.
Yeah, go for it, please.
I'm open to questions too. So really how I got to wanting to try ketamine, the abridged version of the abridged version of the abridged version, started back in, college when I just started, my mind started opening up to all these things and really started reading more Eastern philosophy and Buddhist psychology, and I was just, what is this thing called consciousness? Anyways, jump to 2023, and I'm like, okay, I'm ready. I've been thinking about psychedelics for a while, doing it in sort of more of a controlled, empathetic setting with a counselor. And so my counselor at the time referred me to someone that did ketamine-assisted therapy. So developed a relationship with a new counselor, and we talked a lot about it. And there were about probably 3 or 4 months of sessions of just doing talk therapy, talking a little bit, childhood stuff, childhood issues, using mindfulness. And so preparation was longer. And then she was connected with a psychiatrist that did ketamine injections. And then I went and saw the psychiatrist, and I had a psychiatric assessment from a very humanistic point of view, modality too. He was very warm, and it was like, oh, he's using a lot of basic counseling skills, and so he had a lot of training in the counseling skills. And then we did a preparation session after that. He showed me the room that I was going to get the injection and lazy boy, and there was its own separate informed consent. He went over it verbally, went over everything. He took all my vitals, weight, and so really to get the dosage to a very optimal therapeutic level. And I think at one point during preparation session, and I love this, he said, if you see a door, open it. And I was like, all right, I'm in the right place. Because, I was in that place of, and really, it was really about this letting go of control, just sense of self and reality, and really being able to start to surrender. So hearing that was like, okay. And then part of it was like, okay, what should I expect versus, and really we had that discussion about expectations versus intentions. And expectations have specific outcomes and results. Intention is more of kind of like, this is what I'm open to. And really it was talking about shifting to sort of intentions. And again, that idea of letting go of control and not trying to control, because a lot of times my default mode network or sense of self overactive is, always trying to control things or outcomes or, and it's tiresome. And meanwhile, I was getting more open and close to him. And then we, that next week we had the session, and that is just another story. But I was able to interact with that default mode network from a very sort of detached, I don't want to say dissociative, because there was still some consciousness there. But I also kind of experienced a sort of a non-dual state where expansion of who I was. And I just felt a lot of love. And I think you'll see that, when you read about people's experiences, that they just have this all-consuming sense of love and goodness in the world. And it was, oof. So anyways, how do you unpack that then? So he had a series, hold them up, questions that I sort of journaled, the next day. And really part of the preparation session was letting me know that after the ketamine session, just to allow things to quiet things down, I actually put vacation settings on my email, minimized my interaction with media. And yeah, real quick, I also wanted, that was part of my preparation session too, was to sort of minimize any sort of violent or any images or media that would elicit some anger or fear or anything. And really, so a lot of my preparation was just going back to using mindfulness, and then of course, some things like just not eating or drinking for 3 to 4 hours, because sometimes ketamine can elicit nausea. And when you're on ketamine, you definitely don't want to be walking to the bathroom. So, especially with the injections, which are much higher dosage. And since then, I've worked with my counselor, and we've done ketamine lozenges, which are prescribed by my psychiatrist. And my counselor, my psychiatrist do have collateral sessions, and are done the releases of information so that they can talk, and they're on the same page, which I think is very important to network and to be, working with a medical provider. One that also, my personal opinion, comes from kind of a psychodynamic or humanistic frame, and not so much a medical model that reduces experiences to, just pathology. And so I've had two ketamine sessions with my counselor. She's been right alongside. I'll take the dose. It dissolves quickly. Got the music, and for like the first hour and a half, I'm really silent and just having all these sort of sensations, insights, and she's right there along. And meanwhile, she's writing. I don't know if you could see this, such like almost minute to minute breakdown of salient things that I do, whether it's a deep breath or something. But then as I'm coming down or out, or whatever preposition you want to use, from the ketamine, I became a little bit more talkative, and I started already talking about these insights are having, or I'm just talking out loud, trying to make sense of my experience. Well, not trying to make sense, but just allowing the experience. And so for me personally, there's a lot more verbalizations. And so then after that ketamine session, a couple days later, I come back for an integration session. And she really came from, this is my perspective, I don't really ask her like, oh, what about your training? Because as a client, I just kind of want to focus on my process. She very open-ended, person-centered, a lot of open-ended questions. She would look through the notes, have me look through the notes, and just be like, yeah, notice this. What did you mean by this? And so then I would talk a little bit more about that. And some of it was insights I had about my own male lineage, of what it was like to be Irish and male in my family. And I had these visualizations of this forest, this dead forest, and how all of a sudden this luminance was coming alive with mushrooms. And so I was able to process that experience and what that meant for me, along with my journey. And so it's something that in subsequent sessions we reference, and then the practical things of how can I take care of myself more, how can I take care of my body. And really, we talked about me doing more yoga, being more mindful in nutrition, being more social. So it's those things where I had these like real great existential and psychodynamic insights, if you will. But then there's that sort of practicality. And sometimes that came from just intuition of like, oh my gosh, I need more Tai Chi in my life, or I need more yoga. And I would listen to that. And there was just this sort of intuitive trust in that. But I think also that trust and that willingness and that openness I had, and my intention I really set was like, I'm open to whatever ketamine avails me. But part of that openness and trust was built because of the therapeutic relationship, because of the trust I had with her, and that knowing that if I was going to experience distress, that she would be there. And she offered anytime that I needed a touch, whether it was either shoulder for a little bit for grounding or holding hand like that, that all I had to do was just a gesture, kind of like in yoga class. If you want, touch or something, you do some sort of, so I knew that was there. I haven't needed the touch. I haven't been in that sort of felt that distress. But I think partly because of all the prep, because of everything that was geared toward making that experience very successful for me. Yeah, so I think there's more to share, but I wanted to kind of keep that to about 10 minutes. So yeah, yep, exactly. Therapeutic relationship is, and I know you can go to sort of a ketamine infusions and go to a clinic and nasal spray and all that. But for me, I really, just because of my counseling background, I really wanted that sense of strong intention about why I'm doing this. And it's not just for me, reduction of my depression or cravings or anything. It was more about this, like, moving beyond who I am and who I could become. And so more of that kind of expansive self. So it wasn't just reduction of symptoms. There was a very big spiritual part of why I was doing this too. And so I think a lot of times hallucinogens and other drugs can use kind of a spiritual bypass. I just want to feel better. I just don't want to feel anxiety. And sometimes when we're trying to run away from anxiety, we build anxiety. So that's how that. Anyway, I think any questions there? Or anything you want to add, Josh?
Well, thank you, Dr. Riley. I think everyone, I think this has been the most important 10 minutes of our hour that we will all spend together from Dr. Riley, because again, we need to think of the importance of the therapeutic relationship, which is obviously not just in psychedelic-assisted therapy. We speak about it a lot in the counseling world, right? And as important as the session is and the time that you spend with your counselor and whoever is there in your session, as Dr. Riley mentioned, the preparation beforehand, and even more so the integration afterwards, is the most important part. And if we don't have those two things, it's all for naught. It's not just doing the ketamine. It's not just doing the psilocybin. It's not just doing the MDMA. It is the preparation, setting the intention as well, and the integration afterwards, which is the most important thing. And I think, Dr. Riley, you made a very excellent point, and this came up in an earlier session. It is not something to be taken lightly. That's why we came up with the title of this. It is not a panacea. It should not be seen as a last ditch effort. This is something that needs to be come to with a great deal of insightfulness, and you need and dare I say reverence. I think needs to be held for this. It's not something that just like, hey, I'm going to go do ketamine therapy this weekend. Yeah. Please God, don't do that. Please consult with somebody before you do. And I think too, Dr. Riley mentioned
I lost you.
Josh, you somehow got muted.
Am I the only one that, are we the
No,
only?
sorry, my Bluetooth went haywire. Okay, I'm back. So, you know, I think Dr. Riley spoke very well about the collaboration between the psychiatrist and the counselor is also very important as well.
Yeah. One other piece I'd add that I forgot to share, that like my counselor gave me workbooks, not only for like preparation, but then integration, and it has a lot of good prompts to really answer. So, you know, you can be very kind of more formal about it afterwards with the integration and do the workbook and whatnot, as well. So just wanted to add that.
No, thank you. I think that's wonderful. Now let's we're kind of rounding the corner here, but let's kind of change our focus. So we've talked quite a bit about from the patient perspective, but what if you are a counselor who is thinking about adding psychedelic assisted therapy to their repertoire? Now this is where a lot of the work needs to be done moving forward, but you know, we need to think about what competencies are involved with becoming a psychedelic assisted therapist. We need to look at the program. There's so many programs out there that are offering certificates and training of all kinds. So we need to vet the program. You know, you need to look at the people who are teaching the program. Look up their CVs. Look up their if they've done any research for sure. Look up the syllabus of you know, just as if you were vetting a CMHC program. And of course, you picked Lock Haven University, but you know, really look into what they're teaching, how they're teaching, who is teaching it. And one of the things I think you'll find is the argument of the experiential aspect. Does the psychedelic assisted therapist have to have done psychedelics? It's a great question. Right. But we also talk about it in counseling. Does the therapist need to have therapy? Right. And so that could go either way. I am on the side of yes, the person does have to have that experiential aspect so they know where their client is going. Not everybody feels that way, but that's kind of, you know, a question you have to ask yourself as you're moving forward. So from an informational aspect, who's doing the work? Who is doing the research? These are just a handful of organizations to get you started. The Veterans Exploring Treatment Solutions is specifically a research outfit for veterans and psilocybin therapy for PTSD, worth checking out. And we'll make sure these slides are available to you. And the Beckley Foundation is also doing quite a bit of research. Hefner Research Institute, which is in the DC area with research studies. And of course, I'm sure you've probably heard of the Multidisciplinary Association for Psychedelic Studies and their Alpha Lycos Technologies. That's who had presented to the FDA the MDMA assisted therapy for veterans. So these are just a few to get you started. Take notes on, definitely write them down. Fascinating things going on for sure. So what's next? Dr. Riley, I believe you're going to take a look at these 6 competencies here.
Yeah, and these competencies, I don't, my understanding, they're not agreed upon by the larger community right now. These were competencies that were developed from Phelps and Henry a couple years ago, and they did a very thorough examination of the literature, and through that examination, they were able to kind of tease out these 6 competencies. So I'm just going to go over some of them right now. My notes. Yeah, so, you know, I think ethical integration, self-reflection, you know, it doesn't mention it specifically, but I think having that experiential knowledge of, or not knowledge, but just having that experience with psychedelics in a very intentional manner doing your own work, and constantly understanding, because you're going to be interfacing with people, and you're going to be interfacing a lot of times with people's unconsciousness, and so the amount of self-reflection and what you bring to the session is very important. And I think some of these competencies you're developing at Lockhaven right now. There's trust enhancement, and that to me is like you're helping create that space for that openness and vulnerability that is needed in a session. It is also through that trust enhancement. It's not only the client trusting the counselor, the client's starting to trust themselves in building that self-efficacy of like, okay, I think I'm ready for this journey. I'm ready to kind of look at parts of myself that maybe in a daily I either sort of disowned or repressed or whatever reason. So, and that's part of building that. And then I think, just knowledge of the physical and psychological effects of psychedelics is very important. Having that, knowing what to do in the case of, someone's, having a bad trip, if you will. And then I think proficiency in complementary techniques, and this is a lot of, being skilled, but in mindfulness, or it doesn't have to be mindfulness. It can be somatic therapies. It could be expression arts. So it could be these different. You also bring sort of not expertise, because I don't like that word, but a lot of knowledge and experience with a lot of. To me personally, I think you have to really have a good intimate knowledge of nervous system, and helping someone shift from the sympathetic to parasympathetic, various breathing techniques, grounding techniques. The fifth one, transpersonal awareness, understanding the interconnectedness of individuals and others in the environment. So I think that, and for me, it's been helpful to personally have a kind of more of a Buddhist psychology sort of spiritual framework as a client. Not that I would ever, if I go this route as a counselor, I would never impose my own framework on someone else. But I think also understanding, having some transpersonal awareness. And then that empathetic abiding presence, that alone I just love. Another way of looking at that is equanimity, that ability to respond to someone's hyper arousal in a way that's grounded. So when someone's in a storm, we are sort of that calming, abiding presence. And it's just, while also maintaining that non-judgmental presence, and that everything's going to be okay. So just being mindful of our voice, our posture, having that very attuned presence, attuned to how we are, while also attuning to the client. I think Dr. Dan Siegel talks a lot about that, is mindful therapist, and the mindful brain. So those are some. Those are the competencies on that, and I think we're able to share our resources at some point or somewhere.
Yes. Participants will be getting the deck from us. Yes, definitely. And we'll make sure those links that we gave before are live, and we'll have our reference list at the end of that, so people can kind of dig in a little bit more. Yeah. And to Dr. Riley's point regarding the psychological effects of psychedelics, and as we've spoken the whole time, again, it's not a cure-all. Bad trips do happen, right? They do happen. And so there's also a component of psychedelic harm reduction that needs to be addressed, and people need to be trained up on. And even Dr. Paycheck and I were speaking earlier this week that we as mental health professionals, even if we're not in the psychedelic assisted therapy space, even if we're not doing that kind of work, it's really something we should know about. It is something that we should know how to mitigate. If we, if you get that call or a text from a client, or I heard a story this summer of a religion professor, who got a call from a student at 5 o'clock on a Sunday morning, who said, "I'm in the middle of a bad trip. What do I do?" And this professor did not have the tools for it. I wish I would have met him 3 days earlier, because I could have given him a ton of resources. But and that's something that moving forward we need to talk about in our space, that we need to kind of have that training. So again, that's part of the work that needs to be done. So, but I think that's of the utmost importance. So again, I can't stress it enough that this is not something it's not a magic pill, you know. So thank you, Dr. Riley. And so we're kind of getting close to the end of our time together. And there were some great questions in the chat here. We have, how does this integrate with, let's see, what do we have here?
How can I support my client who is receiving ketamine treatment in our sessions?
Yes. So, Aaron, I just dropped a quick note, but encourage them to talk about it. Ask them the questions. How did it feel? How do they feel afterwards? And going back to Dr. Riley's mention of collaboration, if it is okay with the client, collaborate, speak with their facilitator who is giving them the ketamine assisted therapy, right? So I think the more that we talk to each other, the better it will be, for sure. And the integrating with kind of cannabis therapy and whatnot, that's kind of a longer conversation. I'd love to chat with you about that next week. Be more than happy to. But yes, the open mindset, and avoid falling into the stigma of these substances. Kearney, if I could have that on a t-shirt that I wear everywhere I go, I would. Or a big sign on my forehead, like with stigma crossed out. Because I think that's the biggest thing. Isn't it? People only know from the news that they get.
Yep.
So we as mental health professionals, we owe it to our clients, both current and potential and in the future, to not rely on those news sources, to ask questions, to go to the research, for sure. Sorry, excuse me, Dr. Riley, go ahead.
Yeah, go to the research, but also go to the history. Go to, I think Johann Hari talks about Henry Anslinger creating the DEA, and his duty to very kind of racist intentions and actions against Billie Holiday, and marijuana just became this drug. And so understanding sort of historical context of how the stigma developed. I think Michael Pollan talks a little bit about that too. In the 70s and 80s, war on drugs, and it was also the war on BIPOC folk, and so I think that will also, it will reduce the stigma, but also increase empathy and understanding. And I just think it's a fascinating thing to read about history from valid sources too.
I can't agree enough, Dr. Riley. Prior to 1971, psychedelics had huge efficacy in research, in psychiatry and in the mental health space. Thousands upon thousands of papers and were written on it in a very positive light. And then unfortunately, everything went dark from 1971 on. And we're just seeing this. And the thing is, again, speaking of the reverence and taking it seriously, we need to do the work now so it doesn't happen again. Because I don't have another 50 years for it to go dark. I'll be too old to practice if it comes back around again. So, again, use the tools. It's a wonderful possibility. It could help our clients so very, very much. It could really be transformative. It could really change lives. It could save lives. If you're active in the veteran space, the suicide is obviously a huge problem. It's a daily problem, and it could change things for sure. So let's see. I'm just checking the chat. Yes, more research, more literature, definitely, Dr. Paycheck. It's out there. Go to your Lock Haven University library and go to the. It's there for sure. Or ask us. We have, reams upon reams of research. So we're right at 12:50. Thank you so much, Dr. Riley, for joining us. Your perspective was invaluable for sure. Thank you, all of you, for being here, for opening your mind here during your lunch hour. I hope you found it informative. And again, we're here for it. Please don't hesitate to reach out if you have questions. And there is work to do. There's work to be done. So we are here for it, and that's what we're going to keep doing. So thank you very much. I'm going to stop sharing my screen.